Hello, and thank you for joining us. My name is Dr. Susan Blackford, and with me today is Dr. Deborah Ann Ballard. We are internal medicine physicians with training in integrative medicine, and we'd like to share with you about our program at Duke Integrative Primary Care. So I'm going to start us off and start to tell you a little bit about integrative medicine and what we mean by that. Our agenda today is to talk about integrative medicine and what that is. And then also to talk about our approach. And then we'll finish up by talking about more of the nuts and bolts of the membership benefits and the cost of insurance. So what is integrative medicine? This term is used by a lot of different people, and so sometimes it's helpful to have a definition. What most people think of as integrative medicine is that it's the combination of conventional medicine, what we know as medicine in this country, but then also weaving in other modalities that have research behind them that have shown that they are also helpful. So it's not one or the other, it's the combination, it's both. It's also addressing a fuller spectrum of the influences on our health. So it's looking at the physical, emotional, mental, social, spiritual, environmental, all those things impact our health and are important in our healthcare and need to be considered when coming up with a plan. It's also looking at health as not just the absence of disease, but as the optimization of where you want to be with your health. What is your goals? No matter where you are in your illness or health, where do you want to be? Where do you want to put your efforts? And it's an emphasis on promoting health and then also preventing any untoward effects. So the other thing is that it's also looking at the relationship, kind of re-supporting the relationship between the physician and the patient as being very, very important. It's looking at that therapeutic relationship as being part of the healing process. So it's really developing a closer relationship with your doctor and from there being able to work together as a partner to improve your health. Next slide. So this is our sort of a pictorial of our general approach. This is what we call our wheel of health. And at the center is pretty obvious. It's you. You being the patient or the client are the most important part of this whole schema. And around that is mindful awareness. So this is having an awareness, for you to have an awareness of where you are at this point in time. When you're going on a journey, it's helpful to know where you're starting from and really take an assessment of where you are emotionally, where you are physically, and where your health is, and then determine where you want to go and where you want to put your efforts. So mindful awareness is a way of touching base internally with what's going on in this moment, in this presence. Around it in the flower petals are the different areas of health that are really within your reach to change. These are areas of focus. So there's things that are pretty common like physical activity and fitness. But to go along with that, really a focus on rest and sleep as being an important combination with the physical activity and fitness. It's really hard to gain benefits for physical activity if you're not getting enough rest. So those two really work hand in hand. It's also noticing the approach of the physical environment and how that affects your healing. So when you go into your house, how do you feel? Does it feel really cluttered? Does that make you feel more anxious or unsupported? So paying attention to your physical environment is important. Also looking at any toxins or adverse things in your environment that might be affecting your health adversely. Nutrition, of course, always a backbone of health. I don't think we give this enough focus, but really I've seen a lot of changes that happen just with changing simple things in nutrition. And so nutrition and lifestyle is something that's within your reach to change that can have huge impacts on your health. Mental and emotional well-being. Boy, during this time of pandemic, we've really found out that our emotional wellness is so important in our overall health. And so relationships and how we feel about ourselves are all interwoven in our health. And then fulfillment and purpose, and this can mean many things to many different people. It's why you're here, why you're doing what you're doing. Do you feel connected with your community, with your environment, with the universe? It's however you define it. And again, that's an important area of focus to in terms of improving your health. And then around and the outside is kind of your community, which can be the community you live in, your family community, your community of providers. So it's what all is supporting you, and how can you surround yourself with a community of folks who can support you in your healing going forward. Next slide.
Hi, Dr. Deborah Ballard here, and I'm going to talk to you about how our primary care practice works. Dr. Blackford and I are both board certified in internal medicine, and so our visits are billable to insurance. Your insurance will be applied, and any copays or deductibles that you might have are still applicable. We function as primary care physicians. We will help coordinate your care across the larger span of the whole Duke medical system and surrounding other areas where we work with providers from all the systems to get the team of providers that you need: specialists, primary care, physical therapy, ordering your tests. So all of those things are done just as would be in any primary care practice. The difference here with Dr. Blackford and myself is that we are both also experts in evidence-based complementary treatments, or treatments that are outside the traditional Western medicine paradigm. And this may include calling on our colleagues who practice traditional Chinese medicine and acupuncture. We may use techniques that come from hypnotherapy. We work very much with our nutritionist on evidence-based approaches to make sure that we are optimizing your health with macro and micronutrients and helping you obtain the right caloric balance. We have a behavioral therapy, which is very important for pulling it all together from an emotional and spiritual standpoint. And we may also recommend techniques from Ayurvedic medicine, from herbal medicine, but whatever we do recommend, there's going to be evidence to support it. The likelihood of benefit will be reasonable, and the likelihood that it will cause you any harm will be low. So people have a lot of different preferences in regarding to what techniques they want to bring for their own healing practice. And as long as those practices are supported by evidence and can be implemented with reasonable expectation of benefit and low likelihood of harm, we're willing to have a very broad toolbox of different types of treatments that we can use. Another very important resource that we have is time. So we do have a lower patient to physician ratio than other primary care practices, which allows us to spend a lot of time with our patients working through problems, developing a plan together, lots of communication up front. And in addition, we are also supported by a wonderful team of nurses and guest services who help answer your questions and communicate with you in a manner that moves things along quickly so that there's not a lot of waiting between appointment times, and that we have sufficient time during an appointment to address all the relevant issues on that day. If you're a member of our primary care practice and you need same-day service or next day, that can usually be arranged. and we will work with you to meet your problems in the most timely manner. Either Dr. Blackford or myself is on call for the after hours line for emergencies and for urgent issues that cannot wait until the office is open. We also do provide benefits and discounts to our primary care members for the services of our other providers. And then, of course, the membership at the fitness center comes along with the membership. And that allows you to have an opportunity to incorporate that into your physical activity program if you choose. So in integrative medicine, we truly do apply a team approach. And we have a wonderful team of healers that provide many different modalities of therapy. Kim Turk is our massage therapist. She's extremely well trained in medical massage and is also a very astute clinician who often recognizes problems that are beyond massage therapy and will bring that to my attention or Dr. Blackford's attention. We have two acupuncturists, Janet Shaver and Julie Barefoot, who practice traditional Chinese medicine and use acupuncture to address a number of chronic disorders such as chronic pain, anxiety, digestive issues, allergies, infertility. And all of these approaches are evidence-based. Nutrition is central to all integrative approaches. Joanne Gardner is an integrative nutritionist with many years of experience, and she can help you optimize both your macro and micronutrients, help provide good advice on which supplements are really beneficial, and also help treat problems with our gut microbiome, issues such as SIBO, food sensitivities, irritable bowel syndrome, through a combination of both a dietary approach as well as select use of certain herbal remedies and digestive enzymes. Carol Krukoff is our yoga therapist, and she can adapt yoga, a wonderful mind-body exercise, to a patient's level of ability. So not everyone can do vigorous, advanced, hot yoga, but yoga can be adapted for many different styles and incorporate breath work and meditation in a way that can provide a wonderful complement to your health and well-being. And Marissa Holston is our mind-body therapist who can help our patients work through trauma issues, emotional blocks, relationship problems that are barriers to their health and well-being. So we are very fortunate to work with this incredible team of healers to address all aspects of your health and wellness.
Hi, my name is Melissa. I'm the primary care coordinator at Duke Integrative Medicine. I want to talk about the additional benefits that our members receive. As a member of Duke Integrative Primary Care, some of the additional benefits are 10% discounts on our therapeutic services and programs, such as acupuncture, massage, yoga, and health coaching. Duke employees receive an additional discount. You also receive discounts on our Duke Health and Wellbeing programs and trainings, such as our mindfulness classes and Nutrition Smart classes. Our programs and training department offers a variety of classes for professionals, the general public, and for organizations. Our members also have access to the wonderful healing spaces in our facility, including meditation spaces, a walking labyrinth, which is one of the few on the East Coast, transition rooms with whirlpools, steam room, sauna, and showers, as well as our library. Membership also includes access to the award-winning Duke Health and Fitness Center, which is a medically based wellness center that offers the professional experience of a fitness club with medical expertise. The fitness center offers a variety of opportunities for improving your health and fitness. It includes an indoor pool, whirlpool, sauna, locker rooms, indoor and outdoor track, group exercise classes, fitness assessments, nutritional counseling, massage therapy, and medically based exercise programs. We have a dedicated team to work with you. Our guest services staff is here to help with general questions about Duke Integrative Medicine, schedule routine medical appointments or therapeutic appointments, and also help register for classes or training. The nursing team is here to help you with overall coordination of care, medical questions, triage of urgent medical needs, as well as prescriptions. The membership fee is $150 a month. Once you set up your account, it will be a recurring charge. The visits for your primary care visit are billed directly to your insurance. This $150 fee is not covered by HSAs. There is a membership discount for Duke employees. If you would like to verify your coverage or co-pays, just give us a call. We can help with that. Our financial care counselor, Lisa, is able to do that. And we also have a business manager, Judy, who helps with the membership fees. So next steps, if you're thinking of joining or if you have any questions, give me a call. Happy to answer any questions for you. If you have questions about your insurance, just let me know. I will get in touch with our financial care counselor. If you want the application or the contract to get started, just email me and let me know. Thanks.